Welcome back to Medi, where we dive deep into the essentials of living a healthy lifestyle. In today's episode, we're spotlighting a condition that, while not as critical as prostate cancer, significantly affects many men's lives: benign prostatic hyperplasia, commonly known as prostate enlargement. This condition can lead to frequent and uncomfortable bathroom visits, underscoring the importance of managing its symptoms to preserve life quality. While surgery might seem like a direct approach to alleviate urinary discomfort associated with benign prostatic hyperplasia, it's generally viewed as a last resort. It's crucial to understand that surgical intervention is necessary only if the condition leads to severe complications. The most common among these is acute urinary retention, a complete blockage of urine flow by the prostate, which requires emergency intervention and possibly the temporary use of a urinary catheter. This scenario is not only uncomfortable but can also lead to pain, frequent bleeding, and an unpleasant odor from the catheter. However, there's a silver lining. With proper lifestyle management and adjustments, many individuals can avoid reaching this critical juncture. I'm here to share 4 pivotal lifestyle tips that can help prevent acute urinary retention and, consequently, the need for surgical intervention. Firstly, it's imperative to exercise caution with cold medications. Many patients with acute urinary retention report that their condition worsened after taking common cold remedies. These medications often contain ingredients that can cause the prostate to swell, leading to a blockage in urine flow. If you're living with benign prostatic hyperplasia, it's crucial to inform your healthcare provider about your condition before getting a prescription for cold medicine. This way, you can ensure you're prescribed a medication that won't exacerbate your symptoms. Secondly, limit alcohol consumption. Alcohol naturally increases urine production, which can rapidly fill the bladder and exacerbate urinary retention, especially in individuals with benign prostatic hyperplasia. When intoxicated, the brain may not adequately recognize the bladder's full signals, leading to an overextended bladder and difficulty urinating. To avoid these issues, it's advisable to consume alcohol in moderation and heed the call to urinate without delay during drinking sessions. Thirdly, avoid holding urine for too long. Those with benign prostatic hyperplasia may notice that resisting the urge to urinate can weaken the stream over time. When the bladder becomes overly full, its walls can stretch and thin, diminishing its ability to contract and empty fully. This can create a vicious cycle where the bladder becomes increasingly lax. It's crucial therefore not to let the bladder become too full. For instance, during long car journeys, make sure to take bathroom breaks at least every 2 hours to prevent overdistension. Lastly, ensure you empty your bladder before sleeping. The period during sleep is when urine is held for the longest, which can be particularly problematic for those with benign prostatic hyperplasia, as it can lead to a high volume in the bladder by morning, making urination even more difficult. Adopting the habit of urinating before bed can help mitigate these issues and improve symptoms. Following these 4 tips can substantially reduce the need for surgery due to benign prostatic hyperplasia. Now, let's pivot to dietary strategies for supporting prostate health, focusing on the power of tomatoes. Tomatoes are a rich source of lycopene, an antioxidant linked to a lower risk of prostate issues, including cancer. Did you know the American Cancer Society recommends eating tomatoes and tomato-based products over taking lycopene supplements for prostate health? This recommendation is backed by studies, including one from Ohio State University, indicating that consuming tomatoes can reduce prostate cancer death rates by 26%. It's not just lycopene but a synergy of phytochemicals, antioxidants, and vitamins in tomatoes that bolsters prostate health. To maximize the benefits of tomatoes, here's a straightforward recipe for tomato juice. Start by scoring the bottoms of your tomatoes with a cross. Boil a pot of water with a tablespoon of salt, then add the tomatoes. Blanch briefly until the cuts start to open slightly. After blanching, remove the stems and chop the tomatoes. Blend these with some olive oil, which helps absorb the lycopene, until smooth. 3 tomatoes should yield about 2 cups of juice. Another delightful recipe is roasted tomatoes. Slice the tomatoes and toss them with high-quality olive oil, kosher salt, pepper, minced garlic, and fresh thyme. Place them on a baking sheet and roast in a preheated oven at 450 degrees Fahrenheit for about 30 minutes, or until the tomatoes are soft and roasted to your liking. This dish not only supports your prostate health but is also incredibly tasty. Remember, consuming tomatoes directly is more beneficial for prostate health than taking lycopene supplements. This is supported by studies showing that the phytochemicals, antioxidants, and vitamins in tomatoes work together to prevent prostate cancer more effectively than lycopene alone. We encourage you to share your favorite tomato-based recipes in the comments below to help others enjoy healthy, tasty meals while supporting their prostate health. Thank you for joining us on Medi. If you found this episode helpful, don't forget to like, subscribe, and share it with others who might benefit. Stay healthy, and I look forward to seeing you in our next video.